Hello, I'm Dr. Mira Irons, President and CEO of the College of Physicians of Philadelphia. Welcome to the latest in our series, College Conversations, Medicine, Science, and Society. Today, I'm speaking with Dr. George Wohlreich, immediate past president and CEO of the college for nearly 16 years. During his tenure, he founded the Center for Education, conceived of the History of Vaccine website, recreated the Benjamin Rush Medicinal Plant Garden and constructed the Templeton Veranda, instituted the Philadelphia Orchestra Musicians Concerts, created the Delaware Valley Medical Student Wellness Collaborative, and brought the Spaith Oration to the college. Welcome back, Dr. Wohlreich.
It's a pleasure to be back, Dr. Irons. Thank you very much for having me.
So just to start, how does it feel to be back in this beautiful building that you spent so much time in and also did so many wonderful things for both the college and for the city of Philadelphia in?
Well, to quote myself, I've always thought the building is absolutely gorgeous, but I think the staff and the fellows are what makes it the really important institution that it is, that it continues to be, and that it will become even more so.
Mm-hmm. So, in your many years leading the college, you were involved in so much good work and so many initiatives. And I just, listed a few of those. It would take hours to talk about all of them, but let's focus on a more recent pandemic-related initiative and then move on to the youth educational programs that you love so well, if you don't mind. We've all been immersed in the COVID-19 pandemic over the last 2 years. But the college actually began to think about pandemics before COVID-19 ever became something that the entire world was talking about. The Mutter Museum developed an exhibition focused on the 1918 pandemic that was stood up and is still here for those who want to come and see it, titled Spit Spreads Death. And that became, part of the Mutter Museum several years before the current COVID-19 pandemic. And you also led an effort to develop a pandemic preparedness report that began in anticipation of a future pandemic. But then a pandemic happened as you were developing that report. Can you tell us more about the report, its genesis, intent, timing, and how developing that report and its recommendations might have changed given the fact that a real pandemic happened?
Thank you very much for the compliments. Would that my mother were still alive to hear them. There are two strains, pun intended here, involving the exhibition here in the report. One was, as we were approaching the 100th anniversary of what was called and is still called the Spanish flu epidemic of 1918, 1919, we were aware that this hugely traumatic global event that probably killed at least 50 million people was not part of the working memory of the general public. And it was very strange to understand that. One could put it in context perhaps of World War I and all of the trauma that followed from that, the Great Depression and World War II, probably a continuation of World War I. And we felt that there was a need to remind people what had happened with this epidemic, this Spanish flu. I personally knew about it. It was part of my working memory because my maternal grandmother, whom I never knew, died in that flu epidemic when my mother was 3. So that's part of the background of my personal involvement. Secondly, and independently, former college fellow Dr. Baruch Blumberg, a Nobel laureate, Dr. Harvey Rubin, who has a professorship in medicine, microbiology, and computer science at Penn, and I were aware that there were no true global mechanisms for surveillance about emerging biohazards, whether naturally occurring or synthetically generated. And about 15 years ago, we started trying to get people literally around the world interested in developing a global compact, a global surveillance, reporting, et cetera. And frankly, we came a cropper. We were talking with people in the EEOC, and they said, I'm summarizing many meetings, this has to happen at a ministerial level or it's not going to happen. So that got put on the back burner. In the meantime, Dr. Robert Hicks, who was then head of the Mutter Museum and the Historical Library, and I decided to go for a grant from the Pew Foundation for the exhibit. We got that successfully and competitively and developed the exhibit, which I think, even though I was remotely involved, is a stunning and important exhibit still. And the moving picture, the recreation of the march, is, I think, very important. By the way, parenthesis here, the college was directly involved in encouraging the city fathers and mothers here to cancel the St. Patrick's Day parade in 2020, which they did, thank God. So while we were preparing for the exhibit, we were aware that there was still no mechanism for truly coordinating responses for high incident infectious diseases. Again, whether newly emerging strains such as SARS, such as Zika, such as one of the avian flu varieties, or something that was synthetically developed in a laboratory, purposefully or not. And we went to the Blue Cross Blue Shield Foundation, got a large grant from them with no restrictions whatsoever to develop a report of what was the state of the city's preparation for these possible events. And I say possible because I don't know a single infectious disease doctor right now who doesn't expect another pandemic to occur. Maybe not next week, maybe not next year, but it's going to happen again. And they say that even though most of us don't believe we're out of this one yet. And the variants, they are coming. So given that, we got a report, we started developing a report without trying to point fingers and realizing the weakness of human nature about admitting problems, to see what could the college do as the birthplace of American medicine, as the neutral place, the Switzerland of healthcare, to help people develop programs that might perhaps better prepare us for the next pandemic.
So how do you think, when you think about global preparedness, I mean, we have enough of a problem in our own country with the federalist form of government that we have, where, things come down to the states and each state handles a pandemic differently or in their own view. How do you think that something like that gets coordinated globally? Like, who coordinates it?
The simple answer is, who knows? And is it possible? And depending on your views about the United Nations and the World Health Organization, one can be either hopelessly cynical or hopelessly optimistic, or maybe somewhere in between. But I think it's worth trying. I think one tries things even if one doesn't think one can be totally successful, because at least you have some idea of the issues with which you're dealing and are going to deal. For example, we know that in manufacturing in the last generation, last 25 years, just-in-time inventory control was the law of the land. That's how you made money, that's how you advanced your own careers. Just-in-time inventory control doesn't work for personal protective equipment, for medications. So are there situations in which you need to stockpile things that are stockpilable and that will have some shelf life? That was an example of what we found out. Who will coordinate this? I think human nature will always rear its ugly or its good head. It always will depend on someone saying, I think we have a problem. That's very difficult for people to say, even in our own families, our own offices. It's difficult to be the person who raises his or her hand and says, oops, I think we have a problem. And there would need to be a way, perhaps, of finding how can this be done in a non-judgmental, non-punitive way, so that if something does occur, it can be reported so that someone could think, at least hopefully, rationally, about what might be done. Now, I think I'm not naive, I hope. I'm a psychiatrist, I'm a psychoanalyst, supposedly I know about the dark side. I I don't expect everybody walking around to be a Boy Scout or a Girl Scout, but I think there's a possibility of developing a culture, again, pun intended, in which high consequence infectious diseases could be surveyed, could be reported, could be dealt with. We know that when they're not, the consequences are horrendous.
Right. You know, one of the things that I've thought a lot about just in terms of public health and medicine are siloed. We have the medicine side of the street and the public health side of the street. And at times people walk back and forth across that street, but they tend to be different systems operating at the same time. You know, and most of the time that works well, and then a pandemic happens, and that's when you really want those two sides of the street to talk to each other. But one of the things that I think we've struggled with in this pandemic is this issue of personal liberty and personal responsibility. And it's come up with vaccination and wearing masks. You know, I mean, personal freedoms, you can decide to get vaccinated or not, or wear a mask or not, but you also have a responsibility to other people that you might be sitting next to on the train or on the bus or in the grocery aisle. Do you think that people understand that? And
No.
how do we get people, but how do we actually make that point?
I had hoped that with the international success of the musical Hamilton, people might start reading more about the initial issues and strains that have never been resolved in this country between federalism and states' rights and national policy. We see in today's headlines in the newspapers that these issues are very present and very alive. A simple-minded way of looking at it could be, you have whatever freedoms you can have as long as it doesn't impact negatively on me. So if you don't want to get vaccinated, okay, but don't put me at risk. And I think that is a way of balancing personal freedom, liberty, versus a more community response. I get a little weary of people talking about personal freedom and liberty and independence while they're using federally subsidized roads, electricity, telephone, everything else, all the products that are brought to them. So there is a disingenuousness or a lack of understanding that we really are part of a community. If you're in a shack in Montana, though they now probably cost $10 million a shack, if you're in a shack in Montana in the woods, do whatever you want. But when you come into town once a year to shop at the dry goods store, wear a mask.
Right. Totally. You know, there's that saying, and I always get sayings wrong, that if you don't remember history, it will repeat itself, or
Yep.
something along that line. And you said something earlier when you were talking about the Spit Spreads Death exhibit, is that it's not in living memory. And I think that for the people that are watching this who are in the Philadelphia area or at any point would, you know, come and visit Philadelphia, I would strongly encourage you to come and see that exhibit, because it's eerie. It's eerie when you walk through that exhibit about how real it feels to us now. And 3 years ago, I don't think it would have felt that real. But vaccine preventable diseases are also not in recent memory. So the parents that are making decisions about childhood vaccinations don't remember a world with measles, German measles, you know, people dying of chicken pox. And do you think that actually feeds into some of the growing anti-vaccination movement, is that people just don't remember that that world existed? And what can we do to just help people remember that these are terrible diseases?
I think that is very accurate. There are almost humorous anecdotes that every pediatric emergency department should have one old guy or old gal doc around who remembers what these diseases looked like. So when they come in and the young whippersnappers have no idea what they're looking at, and they say, oh yeah, I used to see 10 cases of that a day.
Right, to recognize the rash.
Right.
Right? Yeah.
Right. Secondly, I remember former college fellow and the only Surgeon General that anyone ever remembers, C. Everett Koop, gave a talk here once that was very moving about losing siblings to whooping cough, to diphtheria, and what it was like for every family to have had close family members die because of these diseases. That is part of our working memory. If we don't see these things, we don't believe they exist.
Right, right. And is it important for organizations like the college, whose mission is to preserve history to help inform ultimate health of the nation, to remind people of those things?
I think it is important. I think without beating people over the head, without taking ourselves too seriously, the college needs to keep people aware of what happened and what can happen in a non-melodramatic way. I want to go back to something that you said, Dr. Irons. I was part of that memorial parade that we did for the exhibit. And I know when I walk through that exhibit and I see that film, and yes, it's dramatic, and yes, there's music, but I think anybody who doesn't tear up watching that
absolutely
should check their pulse.
Yes.
Yes. It's that moving and that important. I want to go to one other thing that's a little bit complex. You know as a physician that one of the most difficult things to teach medical students and residents is a tolerance for ambiguity. Yes. At the same time, respecting science. One of the things that I wish we, the college and people of goodwill, would do is to say, this is what I know, this is what I don't know, and hopefully it will change over time. So that if on day 1 you say X, and then on day 11 you say, oh no, I think it's X minus 1, somebody else doesn't say, got you.
Right, right.
Things change. And to not appreciate that things change, I think, is to do a disservice to people of goodwill who are trying their damnedest.
Yeah. And I think that we've expanded this conversation. The one thing that the pandemic has taught us a lot of things, but one is definitely that everyone's part of the conversation and everyone needs to be educated, and that people have trusted sources. And I think the medical profession, we always think of ourselves as a trusted source, but people go to other trusted sources, community leaders, they're religious leaders. So it's incumbent on us to make sure that everybody understands and has the information to help people make the decisions that are important. The report that we've been talking about will be posted on the college website along with a link to this interview so that people understand the intent and how to contextualize this. Now I'd like to shift the focus a little.
Can I go back to just one thing?
Yep.
I want to reiterate, as an elderly physician now, I don't think we're ready for another pandemic. I don't think we've really learned enough from this time. I think we want to say, oops, even though we lost 1 million people in this country, we ducked that bullet. Well, number one, we didn't duck it. But I don't think we are really much better prepared. And I know there are demands for money for everything, but I think we ought to pay a little bit of attention to this.
Yeah, just think about, we lost 1 million people in this country. I remember early in the pandemic when Dr. Fauci and Dr. Burke were estimating maybe 60 to 200,000 people. And, if it went this way, it might be 60,000. And those were huge numbers. And we're at 1 million. And, I think we've become immune in many ways to that number. And whoever thought that would happen, first of all. But I think you're right. And kind of move into public health funding. One of the statistics that I actually heard from someone in the public health community was that city and county public health lost 30% of their budget between 2009 and the start of the pandemic. And, when you think about it, if public health works, you don't hear about it, right? Because it's working in the background. And what happens when you don't hear about it? Your budget gets cut. And I think that, as a start, hopefully the country will have recognized that public health needs to be funded. In terms of preparing for the next pandemic, the funding that they have now has to continue because it's only a matter of time. And dealing with this one, but also preparing for the next one is important.
I would only disagree with you slightly, maybe a wee bit cynically. It doesn't have to continue.
Well, yes, hopefully not.
Right.
I think we've learned a lot from this pandemic, but just mask wearing. How many people have said to you, this was like the best fall and spring and winter I've ever had, that first year? The influenza rates were down, everyone was wearing masks and social distancing, and people even, that had, seasonal allergies were feeling better. Maybe we've taught people what our friends from, the Asian countries had been doing for years, putting masks on in airports and on airplanes and wearing them at seasonal times when respiratory viruses are out there. There may be something good that comes out of this. I would like to shift to the youth programs that you initiated here at the college. There's a clear need to diversify the healthcare community. We know that. We know that we need to have our healthcare workforce, physicians, other individuals in the healthcare workforce, look more like the population that they're caring for. Can you talk a bit about the youth programs at the college, how you think about them, and what the results have been? They're wonderful programs, and relatively few people know about them.
Thank you for asking me. And as you know, since one of our programs was recently renamed after my wife and me, we're extremely proud of that. I think it goes back to both my upbringing and, although I'm not Quaker, I went to a Quaker college and they brainwashed me that you're supposed to do good for other people. And one of the things that I noticed in medicine, and I went into medicine, as you may know, after being out in the world for 10 years from college, one of the things I noticed is that in any clinic, any hospital, it looked as if it were two different planets. The treating people from planet A and those who were being treated from planet B. And there was a literature that also seemed to indicate that people did better if they were involved in their care with people who were somewhat like them. Now, it's not steadfast, but there's some indication of that. And I thought that there is a really truly random distribution of talent in the world, but there isn't a random distribution of opportunity. And we should try, as the Switzerland of healthcare, as the birthplace of American medicine, to see if we couldn't more rationalize and equalize opportunity for otherwise different or different appearing people. And that was the purpose of setting up the first program for pre-health people, taking kids who might not otherwise think of going into healthcare, identifying them, encouraging them, mentoring them, tutoring them, and helping them. And very long story short, we have been statistically improbably successful in this. In a city that less than 50% of kids graduate from high school, 100% of the people we've had in our programs have graduated from high school. Most have gone on to college or some other form of post-secondary education. Many have gone on to advanced degrees in healthcare, whether medicine or medically related fields. And we think it's very, very important. And again, talent is there. We need to find it. We need to encourage it. So that's what all of these programs are about. And also, as we got a little bit more refined, both in the general junior fellows programs, we were then interested also in a talent pool that often got shunned, and these were LGBTQ kids. And we had a panel here once of about 11 scientists from universities, from giant pharma, et cetera, who told us the problems that they had had, how difficult it had been for them to stay in the closet, how difficult it had been for them to advance academically and professionally. And we thought there was a possibility of, again, helping kids find themselves and become productive members of the community. I remember, I don't know if he's anybody else's folk hero, but Lee Iacocca, nobody knows who he was anymore, just said, one of the greatest shortages in this country in talent is administrative skill and leadership skills. And if you're leading a group of X, those skills are probably transferable to something else. And that's what all of these youth programs are about. To use a psychology word, it's self-actualization and allowing people to see that there are other possibilities.
Right. And I think that's really important. I think some of the kids that are in our youth programs may not even think it's possible, because you need to see the path. You need to see that it is possible, and you need to have mentors who understand your reality, other people that have lived in the circumstances that you're in and that have made it. And I think that's where our fellows come in. Bringing our fellows in to talk to the kids is really important. And, we talk about paying it forward. And for our fellows, it may be an hour of their time. But for those kids, it's like a huge difference, because it shows them that it's possible.
And I think those of us who teach, there's a word that no one uses anymore called generativity. At a certain stage in your life, you want to help pass on to others. You want to help pass the torch. You want to keep the flame going. I know those are pretentious terms, and we don't usually talk about that publicly. But we have children. Right. If we didn't want to pass things on, we wouldn't have children. So when we have younger people who could follow in our footsteps, I think it behooves us, if we have that impulse, to help them. And if we don't have that impulse, we should support other people who do have that impulse.
You're absolutely right. Can you talk about the importance of the small size of these programs and the importance of having a high ratio of staff to students? A lot of times what happens is when you get programs that are successful, the first impulse is, well, let's just add more kids. Let's make it bigger and better and give people more opportunities. But as I understand it, one of the really important learnings from this is the personal touch, the need for the kids to get together and know each other, for the staff to know them well. And that just means that you need more people, more resources to make this happen. Can you talk about the small size of these programs and how that helps?
I would start by saying, if someone wants to give the program a large sum of money, I'm sure they would be delighted to try to see if they could scale it.
Yes.
But absent that, and even though we can cite examples of a kid in a class of 40 who does just fine, but for many kids who are struggling with multiple issues, and there's always multiple issues, the family, the socioeconomic, the ethnic, the sibling stuff, the weight of the past, all of those issues take time, and the resistances and impediments to advancement are very clear. And they need talented, sensitive mentors to help them deal with it. And that's where the small size comes from. We all know from our education in college, graduate school, professional school, small seminars can be really wonderful in some areas. In others, they're totally unnecessary. But I think when you have people who are differentially prepared and who are the first generation ever to do this, and you're below the poverty level, and the income you could provide bagging groceries in the afternoon could really help the family, having a small staff and a richly endowed program can be very beneficial. The fact that we've done so well, I think, shows that it works. And we do know of other places that have tried to set these up and haven't succeeded because they haven't appreciated just how personal and involved it is.
Yes, absolutely. And there is a fine line between, size and personal touch. And it's certainly much easier to hide if you're in a group of 40 than if you're in a group of 20. And it's like small seminars. At some point, the professor is going to look around the table and say, "And what do you think?" And you have to have that answer. So, kudos to you, to our staff. They're just wonderful. So, this can go on forever, but I'm going to ask you for any final thoughts. I always ask people for anything else they'd like to leave with.
I'm always delighted to come to the college. I'm even more delighted to see that it is in your very talented and very spirited hands.
Thank you. Thank you. So, Dr. Wohlreich, thank you so much for taking the time to talk today. Thanks to you all for listening. We'll be back again with another episode of College Conversations, Medicine, Science, and Society soon.